Today I had the pleasure of talking with Dr. Holly Batchelder. Holly is a clinical psychologist from the Bay Area, from San Francisco, and her experience is fascinating. She worked in transitional homeless centers, so getting people back on their feet, the Denver County Jail. She's a very, very human person to communicate with, so this is a very interesting conversation. One of the things that we talked about that really stuck out to me and will stay with me for a very long time, if not forever, is the intersection of AI with therapy. This is something that I've been interested in for a very long time since I started using AI. We all have a tendency, or at least I have a tendency, to use it for more therapeutic, almost like a parasocial relationship. And Holly sheds some light on the implications of that parasocial relationship and the broader, our mental health as a whole. Past that, we also talked about anxiety. We talked about some tools for overcoming anxiety. We talked about fear and overcoming fear. And rounding it out, at the end of the podcast, we talk about purpose, identifying purpose, and what it means to move forward. Holly was very open and she was very honest in this conversation. I haven't been in this situation where I felt the need to go to a clinical psychologist or a therapist. So I was never really exposed to the actual science behind these conversations. It's more about me stumbling across these little tips and tricks in my day-to-day life and all of my personal reading. But she shed some light on some things. She talked about some tools. She shared some tools and techniques and methods that I know I'm going to be carrying with me for a very long time. And I hope that you guys see some value in that as well. But I'm going to quit my rambling here. I'll let you guys listen to my conversation with Holly. My name is Devin Allen, and this is the Still Becoming podcast. Thank you all for listening. I hope you enjoy this episode. If you haven't already, please be sure to like, subscribe, or follow on whichever platform you're listening on. And if you're on Spotify or Apple Podcast, rate 5 stars. It always helps. It means a lot. I'm really excited to talk to all of these interesting people. I have some very interesting ones coming up as well. The reception to this podcast has been nothing but astounding. So thank you all for that. But without further ado, here's my conversation with Dr. Holly Batchelder. You said that there's the union of logic and heart. What does that mean?
Wow, I don't even know I wrote that. That's so funny. Growing up, I had my parents were very different from each other. On one side, I had a very religious background. My mom's side, I grew up Seventh-day Adventist. And so spirituality, our emotions, the love that we had for God and humanity was like the forefront of all the things we did in decision making. And on my dad's side, and growing up with my father, was very science-based, scientific, logic-based. Every decision we made had its pros and cons. And so growing up, sometimes I felt like I was in between those and unsure if I needed to choose more of a direction. And I think becoming a psychologist flowed really nicely with that, because a lot of what I do, my practice, my whole career is fusing the heart with our logic. So science and compassion is really my drive for helping other human beings, right? I'm in the business of reducing suffering. And so we can't do that just with science or logic. We also need to do that with our hearts and our compassion. I think that is a big part of what makes us human as well. So that's kind of the balance that I try to bring to my practice.
Definitely. It's tough to strike that balance. You tend to teeter-totter either way. Some days I feel ultra logical, super analytical, and then other days it's more woo-woo, sort of flowy. How do you strike that balance?
I mean, it's not always going to be perfect. That's the thing about balance, right? We could totally stress ourselves out more about trying to strike a balance. There are going to be some days where we are just based on emotions and we really do need to process things. We have to feel our feelings to heal it. That's really important. And then there are times where we need to take a step back and think very logical. That's really what cognitive behavioral therapy helps with, or the cognitive part is, let's challenge these thoughts. Not every thought we have is the truth, right? Not every feeling is the truth. Not every feeling is technically real, while it could still be valid. And so being, I think, honest with ourselves about what we're feeling is key, naming it, and then potentially challenging those, specifically if they are making our lives worse, if they are potentially irrational. And then that's kind of where I go into a whole spiel about, CBT and the importance of challenging catastrophic thinking or black and white thinking, or emotional reasoning and mind reading, all of that. And so at the same time, going back, if we're constantly challenging our thoughts or emotions, we could potentially be avoiding our actual feelings. And so if we really want to balance this out, we have to allow ourselves to feel first. We have to let it move through us. There's a lot of great somatic work with that and body work. And once it moves through us, because it does, our emotions always do, right? They don't stay in us forever. And if it's still there, if there's something that's still stuck, then that's where we bring in our logical reasoning. That's where we could do some constructive thinking or reconstruct, cognitive restructuring. And that's why it's really helpful to be in therapy if you're someone who gets stuck in these a lot, or these kind of cognitive loops or emotional loops, or you're completely dysregulated. So I don't know if that fully answers your question, but I think it's a practice that we all get better at, and we all kind of find our way.
Yeah, you said a lot of things that I really want to dive into. My mind is sort of racing while you're saying that. I guess the first step is, what is cognitive behavioral therapy? What does that mean?
Yeah, so cognitive behavioral therapy focuses on understanding this kind of intersection and relationship between our thoughts, our behaviors, and our feelings, and how they all interact with each other. So, for example, if you had black and white thinking, if everything that you experience in life is either good or bad, we're more likely to experience more negative feelings from that. Things are going to be a lot more intense. That might impact our behaviors. Like, okay, I did horrible on my speech today. I did horrible at work. I'm going to avoid the behavior part. I'm going to avoid giving speeches from now on, or I'm going to avoid putting myself out there. If we just focus on the thoughts, like, hey, let's take a step back. Was it really the end of the world, or was it really that bad? We're more likely to impact our feelings, which could then impact our behaviors. Another part of cognitive behavioral therapy is behavioral activation. So if you're feeling really low, the idea of still going on that walk, or still going on that date, or still putting yourself out there is also going to impact our feelings. So we're going to try to prevent avoiding the awful things, or the things that make us uncomfortable, to make a difference in our thoughts and feelings. So that's what CBT really kind of dissects. We really look at our emotions and our thoughts, our behaviors under a microscope. We do a bit of tracking, and then we say, okay, what's going on here? How can we intervene? And that's why I love CBT. It's an evidence-based therapy, like many therapies, and it's kind of an umbrella for other therapies I like to practice, such as acceptance and commitment therapy, which focuses a bit more on values and mindfulness and more flexibility. Dialectical behavioral therapy, which really focuses on our interpersonal relationships and our relationship with ourselves, and emotional regulation and distress tolerance. And so CBT is a really big part of what I do, and a big part of my training during my graduate school.
Yeah, I didn't realize there were so many different types of therapy. I always just thought of it as this one thing that people go and do.
Yeah, that's kind of interesting. If you're someone who hasn't been in a lot of therapy, I can imagine there's a perception of the stereotypical therapy room. You're laying on a couch and just talking. While that actually can be helpful, free association and process-based therapies, there's definitely a lot of great stuff on psychodynamic therapy. That's more Freudism. We could talk about that probably another time. But the real work gets done when we're using a lot of this more, I guess, cognitive tools and challenges. And this is why it's so helpful to have an in-person therapist or virtual therapist. But I guess what I'm really saying is this is why it's helpful to have a human therapist, because there's so much nuance to our thoughts. There's so much nuance to our emotions and our behaviors. So versus, I'm jumping into kind of the AI, chatbot stuff. It's just really hard to replace that. And the reason why it's so hard to replace that is because over time, you're really building a relationship with another human being who's really detecting not just the patterns of your behavior, your feelings and thoughts. It's sort of tracking the relationship over time, because a lot of evidence points to the reason why therapy is so effective is the trust and relationship you have with your therapist. So talk therapy can also be really helpful for folks who are not experiencing a high amount of distress. That's where you talk to a therapist about what's going on during your day and the stresses you have, and you're either getting support, validation, maybe some problem solving, but really it's more of a kind of client-led session, and it can be something you get that can be really useful. This is also something you can do with your friends. I mean, I believe that sometimes having a best friend or a really supportive family is just as good, if not better, than therapy. But the type of therapy I do, which is more specialized for more severe anxiety disorders, is much more structured. So instead of, while we might have some time to check in and say, hey, what's going on right now? What's going on in the world? We have an agenda. We get really clear about what the goals are, not just in your therapy, but also in session. So you're actually making progress. And we'll track that too. There'll be assessments that are looking at anxiety or stress or even depression, OCD symptoms. And I feel really strongly about that as a clinician who has a kind of specialty in anxiety. The reason why is because I have worked with so many clients who have been in therapy for many, many years and didn't see an improvement in their anxiety. In fact, if you have more severe anxiety or OCD, that type of therapy could make it worse. You're essentially ruminating on your fears and your thoughts, or you're getting reassurance that everything is going to be okay. And if we want to treat OCD, if we want to treat like anxiety at its core, we actually need to find ways to not be reassured. We need to tolerate not knowing. And so being uncomfortable, you're not going to be tortured in therapy, but being a little bit uncomfortable and going to those places and having a hard time with it, that's good. That's where we see progress. And last thing I'll say about this is I do like the kind of analogy of exercising or working out, right? If you were working with a personal trainer and you're lifting small weights and you weren't seeing a difference, but it felt good, you weren't really pushing yourself, that's fine. You might be in physical therapy, personal training for quite a while, and it works for you. But if you really want to make progress, or if there's something you really need to change, we do have to push it, right? We do have to stretch ourselves. And that could also mean not feeling that great and potentially feeling sore the next day. This is where we see progress. I think that's an important analogy that I help my clients with this is their therapy. It's really important that we take it seriously, depending on your goals, what we want to achieve.
Yeah, there's a real visceral element of going in person and talking with somebody, even if it's just your friends. I remember a couple of years ago, I was a field service engineer, and I was traveling across the country. And you'd think that'd be fantastic, right? But after a couple of weeks flying to different places and not knowing anybody, for weeks at a time, it gets lonely. And those phone calls just don't substitute it. They just don't.
Yeah.
You really want that in person, that face to face, the looking at their smile, the way they're sitting, the way they're standing or walking. It makes a big difference, and I can see how that would translate over to therapy as well.
Yeah, that's a really good point. And the pandemic showed a lot of us how important kind of face-to-face interactions are. And while I'm still a huge fan of online sessions, that's something, I'm a virtual therapist already. It's something I really encourage my clients to do, is where your in-person connections. Who are you talking to in real life as well, versus, and it's specifically versus just phone calls. Human interaction is important. Simple as that. Even if you're just going to the grocery store and you're smiling at the register, we know that that's what we need as humans.
Yeah, definitely. You had said something that I want to dig into a little bit more. You had mentioned that it's not entirely good to reinforce or to sort of, how did you say it? You said to affirm somebody's belief or somebody's anxiety or OCD trigger, tell them that it's okay. Why isn't that
Mhm.
good?
Yeah, that's a good question. Naturally, that feels that would make sense, right? For anyone, if we're comforting our friends, no, you're going to be okay. It's everything's going to be just fine. And while that there is appropriate circumstances to say that and share that, we do need that. But if you are someone who struggles with high anxiety, that can become sort of a kind of almost like compulsive. And by compulsive, I mean it's a behavior that needs to be done as an urge to lower anxiety and nothing else is going to work. So if you kind of imagine, I guess, OCD as a cycle, there's a trigger that scares us. Let's just use something that's pretty common these days is health anxiety or health related OCD. So, say the symptom is I just felt a bump on my neck. What is that? An intrusive thought or what we call obsessions. It's an unwanted, intrusive, probably very vivid image that's very distressing. Could be, oh my goodness, this might be cancer. This might be throat cancer. And then you have all these pretty like awful scenarios or images of being in the hospital and going through the treatments and then imagining your own death, saying goodbye to your loved ones. Pretty intense, even if you don't even have a history of it. But it's extremely uncomfortable to the point where I need to do something about this. So Googling, probably the first thing most people do. What are the symptoms of throat cancer? What are the symptoms of any type of cancer? Do I have that? Do I check? And so other compulsives could be, or other compulsive behaviors might be, and these are all time consuming, and that's really important. Asking various doctors, maybe asking one's partner, hey, do you think I'm okay? Do you think is there something going on? Am I okay? Am I okay? Even one's therapist. And while a therapist might say, hey, we looked at the data, we looked at your evidence, we looked at your doctor's appointments, your doctor said you don't have cancer, you're going to be fine, it's going to be okay. That relief that we get from these things that kind of bring down the anxiety could end up being part of this pattern that your body really relies on and needs the next time you get triggered. So the trigger is gone. Okay, cool. I don't have throat cancer. But tomorrow or the next day might be another physical symptom, which could be completely mundane and not mean anything, or it could be something serious. We don't know, right? Say you have a headache and that's, here we go, it's brain tumor. I knew it. Okay, let me look up what brain tumors are. What are my chances as a person my age? I know so-and-so who has one right now. This must be brain cancer. And we're going through that loop again. Therapists, people in our life say, you're fine. And it works until it doesn't. In fact, you might even need more reassurance because the OCD gets stronger with that. You're actually feeding the anxiety part of your brain saying, yeah, you have power over me. I need you to keep fighting me to tell me that I'm wrong. So the alternative to that endless, very, oh man, like chronic cycle that a lot of people have to experience with is, can I sit with the unknown? Doesn't mean we can't do things that can relieve our anxiety. We just need to be very aware if we're stuck in that really endless pattern that's actually maintaining the anxiety, that's actually making it worse. So if I'm working with someone with OCD, we are not allowed to say, oh, everything's going to be totally fine. What we say instead is, maybe, maybe not. So one could be, I think it's going to be the end of the world. I think this is the end of the world, right? That's a common one right now. And one of the rules in OCD therapy is maybe, maybe not. I know my boyfriend's going to break up with me. I can just tell. I can see I can tell the way he looks at me. And we say, maybe, maybe not. And so we got to sit with that maybe. We got to tolerate that discomfort. And then we keep going on with our lives. We do the things that make it meaningful. And that the OCD part of our brain that can wants certainty, that wants to know that we're going to be safe, that wants to know the world's going to be totally fine, doesn't like, it actually gets smaller, doesn't like it when we say, we don't know, but we're still going to do our best anyway. We're still going to take care of our health. We're still going to go to our doctor's appointments anyway, but we're not going to do it to the point where we're letting anxiety win. We're letting it take over our relationships. We're not going to let it take over our jobs and the things that are really meaningful to us. We're going to still live with it, and we're going to find a way to still make life meaningful.
Yeah, I think it's precarious, right? especially in this day and age where you can find so many resources that can positively affirm your beliefs. You can make a Google search. You can say, oh, what are the symptoms of cancer? And it's like, oh,
Right.
well, you don't have cancer. It's like, okay, well, maybe I searched the wrong thing. I can find something that
Absolutely.
affirms that belief.
Absolutely. This is where we're we're entering very different territory with AI.
Hmm.
ChatGPT is known for kind of glazing and really like over. In some ways, I'm like, this is great. We all needed this. It's almost like we're being there's like some gentle parenting going on when we're feeling really awful. And from a health anxiety perspective, there's potential for these kind of AI therapists or even just ChatGPT to kind of fuel that cycle, the endless cycle of needing reassurance all the time. If AI is down or ChatGPT is down or our internet is down, then what? Right? We really got to find a way to not rely on these things either for that reassurance, because that's actually what fuels the anxiety or the anxiety cycle. That's again very chronic and pervasive.
Yeah, yeah, and then you start to develop these sort of parasocial relationships with
Mm-hmm.
a chatbot.
Mm-hmm.
I saw that it's really, really easy to do. It's kind of frightening how easy it is to
Sure.
to develop those relationships with something that's not even real. This is a large language model. There's not much behind it. Uh,
Mm-hmm.
I remember when I first used ChatGPT, it was GPT-3. It first come out right before the big hype, and I sent it some of my writing. I was like, "How is this?" And I was like, it said, "Oh, this is the best writing ever. This is fantastic." I
Mm-hmm.
was like, "Oh, look at me. I'm making progress." And I showed it to
Mm-hmm.
my friend, and he was like, "Oh, this is your worst work ever." And I was like, "Oh,
Right.
okay, all right, back to the drawing board." But
Mm-hmm.
uh, and then you do end up going back to the AI because it said that positive thing. It
Mm-hmm.
didn't criticize you, and taking criticism is difficult a lot of the time.
Yeah, well said. It's really reinforcing.
Yes.
Absolutely. It's going to be a big part of a lot of people's lives, specifically younger people. Um, I'm more positive with AI and mental health. I do think that there are a lot of benefits to it as far as like journaling prompts and thinking a little bit deeper. But the concern is if you're not seeing a mental health professional with if you have a mental illness that's a little bit more severe, that those
Mhm.
symptoms can get worse.
Yeah, it's fascinating. It's so quickly become such an important part of everybody's lives. You think two
Mm-hmm.
years ago, none of this was here. No, nobody
Yeah.
was using AI. My 9 to 5 just adopted Google Gemini, and
Mm-hmm.
it's freaky. It's freaky. A lot of people are getting nervous.
Mm-hmm.
Why do you think that is? Why are people so anxious about AI?
So it's a big topic of my work because I work with a lot of techies. I've worked with people who are integrating AI in their work specifically, or have like been at the forefront a lot of the kind of AI research. And so I think to kind of distill a lot of it down, a lot of it is it's a lot of like identity shifts going on. We worked so hard in a career, and now there is a system that can just replace that, and it's growing faster than our nervous systems can even comprehend. How can that not be scary? And not even just from like the Hollywood, like, kind of like robots taking over type, but more kind of identity stuff, like existential. Like, then what is my purpose? What am I here for if I can be replaceable? And the layoffs, specifically in tech, not just, related to our economy, but also because of AI, that is getting a lot of people a little bit anxious about what can they contribute, what's our meaning, what's our purpose in our work. And this doesn't just go for engineers, other people in tech, or writers, artists. This goes for myself too as a therapist, right? If I have folks who use ChatGPT in as therapy, and I'm grateful because we integrate that into our practice. We look at their notes or summaries, and it's really beautiful to kind of have like a third brain here. But when we really, really think about like the impact of this, we can absolutely spiral into despair. and the fear that this is going to completely take over. And the truth is, there's just so much we don't know. And so the thing about anxiety really is a fear of the unknown, whether it's anxiety before an interview, and anxiety before becoming a parent, or just a date, or our own health. AI represents the unknown. We don't know exactly how it's going to become part of our lives in the next 2, 3, 4, 5 years. And most experts in AI are really shocked that the stuff they thought that was going to happen 10 years will happen next year. And that's scary for anyone, I think. And for those who aren't scared or anxious about it, I would say there might be some avoidance going on. We're not really paying attention to what's going on in the advancements. Not that we all need to be anxious. I think there's a healthy level of awareness, but avoidance is a really important understanding in therapy, because when we avoid things, it just gets worse. It's going to come back to us anyway. So it is important to be real about it, for sure.
Yeah, I think a good analogy that I like to use is the Industrial Revolution. You had a whole bunch of laborers. They would work super long hours, and it was terrible. They were dying, and then these things came along that could do their jobs. And they're like, hold on, let's take a second here. This is how I feed my family. What do I do now that the steam engine is here? What do I do now that all of these different things, automated mills and whatnot? It's very similar, but it's a little bit more frightening, because after that we sort of found our footing. We said, okay, at least humans have a brain. You can't copy the human brain. You can't outsource that. It's like, oh, well, hold on, maybe you can. That's very weird.
Absolutely. Technology has officially mimicked how humans talk and write, even decision making, conversations. This is huge. This is like rapid advancements that are scary, and that's what feels unpredictable, and it's also really hard to understand, especially emotionally. So yeah, I think AI just touches over everything on a lot of core fears: loss of control, uncertainty, disconnection from other human beings, irrelevance. I think that symbolizes that there's something outpacing us, perhaps, and that's scary for perfectionists. That's scary for creatives. That's scary for tech workers. I think for me as a parent, that's kind of scary. And so this actually like mirrors, for some people, this could mirror past trauma, or even grief around meaning and identity, right? It's like there's even grief around like mourning our stability, and what life was like before AI. I can imagine that will be conversations we have in the future. Like, do you remember, we weren't even prepared for this. I remember what life was like before this all existed, and we're that generation that remembers. My kids won't remember at all. They're still kids. They're still little.
Yeah, it's this, to me, it's this weird feeling of like acceleration. It's like you're in a car and it's your foot's all the way down. Then you can't take it off because now the car is driving itself. It's taking the reins. What do we do from here? How do we maybe not stop the anxiety, but at least understand it some more?
Yeah. I mean, there is things we can do about this. My main tips are: one, we name the fear. Like, let's get specific about it. For anyone, if a client came in and said, look, I'm really anxious about how AI is such a big part of the world and I'm scared, I would want to know what's scary about it specifically. So get very specific. If it is around the fear of losing one's job or loss of control or irrelevance, is it more purely existential and uncertainty? Is there a disconnection and fear about our relationships? We want to get deep with it, but we also just want to be specific. Again, a famous saying in therapy is name it to tame it. If we can't name the fear, we're not really going to be able to control it. The next part is we're not gonna try to outthink uncertainty. We're not gonna try to even avoid that fear. We're going to learn how to really sit with it. And I will say, you might have heard this a lot from, actually, I don't know if you've heard this, but really, again, popular kind of therapy saying is sit with it. sit with that feeling and to like really sit with something was a lot different than I think we're kind of trained, right? We're like, okay, yes, I felt the emotion. Okay, I'm moving on. But no, like imagine that emotion in your body. Imagine where, give it a color, give it a name, give it a shape even. That really gives us more power over it. It kind of externalizes it. So sitting with it is a way of really processing that emotion so it doesn't get stuck in us. And then, if someone was in therapy for this, because this is something I do get to specialize now in, is we get really clear about what our values are. When we're clear about our values, whether that's related to our relationships or our health, leisure, work, different principles we want to stand by, that helps us feel like we're in more control, right? So we're choosing values over control. We're choosing what really matters to me in this pretty relatively short life that we have when everything else is going to outlive us, including AI. What matters now in this life that I have? And so there's a lot of beautiful exercises in acceptance and commitment therapy that really helps us think about the short time we have on earth. There's like a eulogy exercise where there's a gravestone exercise where you have your name on it and you imagine like what really mattered. One of my favorites is I'm not sure if I'm making this up, but I think there was a supervisor when I was in my residency talk about imagine a documentary being written about your life, and everyone in that documentary at the end of your life is saying what they loved about you or what they admired about you or what you did on this earth. Those are your values. The first things that really come to mind are the things that matter. And so in anxiety treatment, we want to be clear what our values are. That's called values clarification. And we want to move in the direction of those values. When we can reconnect with what makes us human, whether that's our creativity. I'm a huge fan of creativity. There's so much research that backs creativity being a really great tool for managing anxiety. When we can reconnect with our empathy, our connection, embodiment, which is like this, like being in person, being a human being who has a body, we're less likely to just spiral out of control with anxiety. And so I think the very last thing I'll say about what we can do about this is probably around tech boundaries. I think that can be really useful so we can stay more relational. So sometimes I have folks really monitor how much they're using their phone or their computers or even, ChatGPT, right? We want to get clear if it's aligned with our values, if it's helping our values and getting us closer to our values, that's great. But a lot of the times it can be really useful to get clear what boundaries we can set and more in-person interactions. Overall, we can't really control AI and what's coming, or the people who have the power in their hands to like integrate this in society. I mean, that's kind of a whole nother thing. But we can control who we want to be in the face of this big change that we're going through as a society, as a world. And I think that can be really empowering.
Yeah. You touched on two things that I came across organically. I've never been to therapy. I think it's very valuable that everybody, even if they don't feel like they have a problem or an issue to solve or something to address, to go to therapy and engage with that. Just like you go to the gym, you should take care of your mental health. But two things that you mentioned that I did on my own was the documentary method and the eulogy.
Cool.
I did those, and I didn't expect much going into that. I thought it was like, oh, that's kind of silly. This is a silly exercise. But 10 minutes into writing the eulogy, I was like, tears were rolling down my cheeks. I was like, wow, this is it's very powerful. I'm such a huge proponent of writing. And there's one method of writing that I came across very recently while I was researching an episode for the podcast, and it's called the Pennebaker method. I don't know if you're familiar with that.
Maybe? I don't know. Maybe remind me.
Andrew Huberman had talked about it. He had a couple of...
Love him.
Yeah, a couple of good blog posts on it. But it's basically where you choose a topic, something that's... something that you can think of, that you can address.
I know what you're talking about.
A sort of clear mind, and then write about it, stream of consciousness for 20, 30 minutes, 4 days
Mm-hmm.
in a row. And it's touted as having all these benefits, is like equally
Mm-hmm.
as effective as cognitive behavioral therapy. But I think it's a different kind of effectiveness, I feel, because
Yeah,
you still don't get that human interaction. But what do you think of that?
absolutely. Okay, so obviously, I know there's research that shows that deep processing is really helpful for us for anxiety, depression, PTSD, even our specifically our memory. Um, and it's less about venting and more about creating, and this is why narrative therapy is so useful.
Mm.
You're creating a coherent narrative, and that integrates our emotions, our feelings with meaning. And this is why therapy is so great. And again, I'm like such a obviously I'm a huge fan of therapy. This is my work. But I do want to say, as you mentioned, not everyone needs to be in therapy.
Mm.
It's not really a I mean, well, yes, connection, validation, tools for emotional regulation. Um, Sometimes you need to, not everyone can engage honestly in it.
Sure.
And if we're pressured in it, it's not going to be helpful. Sometimes people feel more at home with just coaching or peer support. If you're in deep crisis or in danger, therapy is actually not going to be useful. You need stabilization or medical care first. So therapy is not a it's not a fix all.
Sure.
Therapy can happen in reading a really good book or taking a walk with a friend. But back to the Pennebaker method. From what I recall, the reason why it's effective is because it makes our emotions meaningful. So it's not venting, it's creativity. And when you're creating a language around what you feel, you're then giving your brain this chance to like recognize this as like a worthwhile or not worthwhile. You're reorganizing the experience. And
Mm.
so it's great, but not something that can replace like active trauma, if that makes sense, or acute crisis. It actually can actually that would probably be harmful. Or if you're feeling already emotionally dysregulated, you can actually feel a lot worse from that. And so you might want more grounding, containment skills with the therapist. Otherwise, it's awesome as a journaling prompt.
Yeah, you had mentioned there acute crisis.
Mm-hmm.
What's the difference between like a chronic stress and like acute
Oh,
trauma?
so well, acute trauma, acute stress. Acute trauma is this period right after something traumatic happened. And by trauma, we mean you either witnessed violence or experience violence yourself, or even, trauma more broadly, some sort of grief, loss, assault, breakup, whichever it is, it completely just dysregulated the whole nervous system. So an acute crisis is a very intense period where you're experiencing full nervous system dysregulation. So maybe that's panic attacks. Maybe there's other severe anxiety symptoms like not being able to sleep for several days. Sometimes this is dissociation. So you could actually just be in shock um, or flashbacks, emotional flooding. So things just, you can't even regulate, you can't think clearly. This is scary. Suicidal thoughts and urges. This is an acute crisis, 100%. And so in this moment, your body is really just in survival mode. Expressive writing might be a little bit too raw. It could be destabilizing. It could be re-traumatizing. This is where we want to focus on more grounding techniques before we dive into the trauma. Hmm.
Yeah. What are some grounding techniques?
So the basics, the most basic grounding tool is coming back to our breath. So regulating our breathing, slowing down. And that could be diaphragmatic breathing. And I know, Dr. Huberman, he talks about this a lot too, right? The power of our breath too. The physiological sigh, right?
Mm.
Box breathing. Breath is one way to anchor our body. And there's other tools too. So maybe that's feet on the ground. Maybe that is tapping, the butterfly taps. Maybe that is looking at the corners in the room that you're in and just noticing the stability of where you are. It's getting the body in a more regulated state. And so while breathing, long exhaling brings more oxygen to the brain, we're activating that rest and digest system, the parasympathetic nervous system. We want to we really want to practice these tools when we're already when we're feeling calm. So when we are in a crisis, it's not like a brand new thing. So that's why that's why meditation, in my opinion, or mindfulness is so helpful. We're actually practicing for when things get really hard. It's more natural. Another classic, this comes from DBT, is like the five senses. So you name 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you smell, and 1 thing you can taste. And you can do this anytime you want, right? It just brings you into this more state of calm, and there's so many. I could keep going, but there's really great lists on grounding techniques online, and the DBT manuals have a lot of good stuff. Putting your face in ice water is a great one that kind of, what's it called exactly? I need to I forgot what it's called. I need to look it up. But the freeze response, or is it polyvagal? I'm gonna look it up really quick. You might have to ice and water, like polyvagal. What is it? I think okay, so ice and water, like having your face in water, it does help with. I'm so sorry, Devin. Okay,
No worries. That's
I was
okay.
going on a tangent, and then so you just have to take that out. But the ice and water thing. But basically, anything that really helps your body feel grounded and regulated are going to be things that slow us down. And we're not used to that. This is a pretty fast-paced world we live in.
Yeah, definitely. Yeah, it's really hard to find that awareness to know that you need to slow down. That's something I've been focusing on a lot lately.
Oh, cool.
Since I started this podcast, I have a sort of social anxiety. I get I start to blush, and I get sort of almost like hives around my neck, and then my breathing
common.
gets really, really heavy. And I've noticed that since I started this podcast, those things, the box breathing especially, has been very useful. But more than that, it's important to do those things when you're in a normal headspace, so to speak. So taking 15 minutes in the morning and practicing awareness, practicing those grounding techniques, the benefits of that are immeasurable.
Absolutely. Yeah. When we have it as a practice, it really pays its dividends throughout the day and throughout weeks. And so it's not something and I think this is changing now. It's just not something we were taught from a young age. I think more courses and classes, and I even see that at preschool. We're teaching my kids when they're in their preschool, getting kind of mindfulness lessons. That's awesome. I wish I had that as a kid. I didn't learn this until grad school. But what a difference it makes to slow down. But that's really cool and thank you for opening up about social anxiety, because social anxiety is super common. And it's also really adaptive in this world where human relationships matter. And so, of course, being judged or rejected, humiliated are fears. I think underneath all that is just our very human need and deep longing to feel safe and connected with folks. So it's definitely something that I think more people should talk about. So thanks for bringing it up.
Yeah, of course. I think it's so common nowadays because you can hide behind a mask online. You can create this persona on Discord or Reddit or on any video games. You can create this person that you really aren't. So when you do have to go outside, you have to go to the grocery store, you're kind of uncomfortable. You're like, who actually am I?
Right.
Yeah.
Absolutely. It's very disorienting. And again, the most important thing you can do with social anxiety is do the fear anyway. Like keep going, keep putting yourself in these uncomfortable situations, because that's, the exposure, gradual supported exposure to feared situations is how we treat it, right? There's this thing called expectancy violation, which is anytime something happens differently than what you expected, that's making the brain so much stronger and more resilient. And so say you have a party that you've been avoiding, you don't want to go to, and at that party, it shocks you that you talked to 10 more people than you imagined. Or it shocks you that someone did something really crazy at the party and you laughed about it. Maybe it shocked you that it was more anxiety provoking than you thought. Whatever it is, really pay attention to what was different than what you expected, because it just like primes the brain and the body to enjoy different outcomes, like seek out, be curious about the unexpected, because we're so conditioned for good reason to want to be in control and to have predictability. And so if we can kind of train our bodies to be curious and really look out for what's different than what we thought something was going to be, man, that's like a superpower that can like be really life-changing for folks who are wanting to get themselves out there, go out of their comfort zone, or get promoted at work. I think that's a really underrated tool and skill.
Yeah. One thing about humans is we love to be right. We love to be correct as often as possible, even when we have those intrusive thoughts that are really irrational. I was on a hike last weekend, and so social anxiety and heights, those are my two big things that I'm trying to get over right now.
That's great. Yeah.
So I was on a hike, and it was up in New Hampshire in the White Mountains, and up there's some in this particular mountain, it was a ridge hike. So we were walking along the ridge, and there's this sheer drop, like 50 feet, and that's a no-go for me.
That's terrifying.
I'm not a fan of that.
I'm with you.
10 feet is too much for me. If I can fall and I can bruise my ankles, that's no good. No good.
Yep.
So I was walking along this, and I had my friend behind me, because if he was in front, I wouldn't have taken the first step. He had to be behind me, sort of like ushering me on. And I had an intrusive thought, and actually from my conversation with Carrie Burke on, we talked about intrusive thoughts. It's like sometimes you have to address those. It's like, okay, my brain is saying, if you look over this cliff, you're going to fall. I was like, is that true? I don't think that's true. So I looked over, and lo and behold, I'm still here. I didn't fall off any cliffs. It turns out that I can walk on like a 8-foot section of rock,
scary.
no problem. So overcame it. And I think taking that time to I don't know, almost humble yourself in front of your own thoughts, because we love to be right. We love to be right. So humbling yourself in front of that is really important. But how do you take the first steps if you've never done that before?
If you've never humbled yourself or never questioned. So I want to say something first, which is over 90% of people report experiencing intrusive thoughts at some point.
Wow.
That is really high. Psychologists love talking about intrusive thoughts, and we love sharing with each other what our intrusive thoughts are. A popular one at the postdoc that I worked at was for those of us who live in West Seattle, we'd have to go over a bridge to get to our downtown office. Was, oh my gosh, my intrusive thought was, what if I just drove off this bridge? That's a really common one. New parents get a ton of them. The thing about OCD or severe anxiety is that we attach meaning to what those thoughts are, and that's something we want to prevent. So basically, it's this idea that if I had a violent thought about myself, that means it's going to happen. Like you said, if I think I'm going to fall, I'm going to fall. If I imagine just hitting that person over there, then that's what I want to do. And that's not true. Our thoughts do not equal the truth, and they don't equal intentions. Most people let these intrusive thoughts pass. Like, oh, that was an intrusive thought. I just imagined doing the worst possible thing a human being could do. And it's not sticky, because OCD has sticky thoughts. It's like, it just like attaches to meaning. So what we do here is, instead of trying to suppress it, which is called the white bear effect, you've probably heard, right? I don't want you to think of a white bear right now. Try really hard not to imagine the white bear and how furry it is, how big he is, and his teeth. You're thinking about it, right? And you weren't even thinking about a white bear before this. So the more you try not to think about it, the more it shows up. Instead, we recognize that these thoughts, we can unhook from them. And a lot of the times, whether that's sitting with it, letting it pass, sometimes we need to see the thought just that, as a thought. If OCD has been more present in one's life, it's going to be harder to unhook. And this is where we pull out the big guns. Exposure and response prevention, right? Evidence-based kind of gold standard treatment for OCD. ACT can be really helpful here, some of the values work that I mentioned, and sometimes medication can be really useful for this too. And it's really a mixture of all of those. But with exposure and response prevention, which includes exposing ourselves to the distress, to the thoughts we have without the reassurance that we normally get or the compulsion we normally get, we can officially kind of free ourselves from that hold that OCD has with us. And I'll say something really quickly. When I worked with children, we would use the kind of analogy or the metaphor of the OCD monster. And sometimes I use this with adults too. I think it still works. Every time you fight that monster or even bully, let's say like the schoolyard bully who's just such a jerk, and say he's telling you, Devin, you're the worst person ever. And you know what? And that thought you had about falling off the cliff, you are going to fall off the cliff and you're going to sprain your ankle or whatever it might be. Instead of saying, that's not true. I would never do, I'm not a terrible person, or I'm not going to fall off the cliff. I'm not going to, he likes that. The bully loves that. He likes that you're putting all this energy and effort. You got under his, he got under your skin. What we want to do with bullies, instead of like ignoring completely, because that doesn't always work, we say, you know what? Whether I'm a bad person or good person, who knows? I'm going to focus on what makes me happy. Or, yeah, you know what? I have no plans to fall off of a cliff, so I'm going to just keep walking straight. Not planning to jump off, so I'm going to keep walking straight. It's not going to be helpful to like sit with that, or not sit with it. It's not going to be helpful to fight you on this, because all I need to do is continue this hike, right? Bullies hate that, right? Or if you say, oh, your wife, she's going to leave you because you're just the worst. You could say, yeah, maybe that would be really, really unfortunate. If she left me, I'd be heartbroken. And that's up to her. She does that. I would rebuild my life. But thanks for your concern. And we do this with anxiety too. There's a little bit of kind of talking back with, right? We don't have to befriend our anxiety at all points. We don't have to befriend the OCD monster or OCD bully, but we don't want to fight it. We don't want to feed it. And feeding it could also be, saying, no, that's not true. My wife, she loves me so much. She just told me she loved me. Actually, let me text her again and ask if she loves me. Yeah, she's not mad at me. She loves me. The bully is like, look, I got you under my spell. Like I got full control over you now. And so again, there's a very empowering kind of message to exposure and response prevention. We're kind of taking our lives back. We're taking ownership of how we respond to the thoughts that we might not have control over. This could be applied to uncertainty in the world right now. This could apply to AI. We really focus on what we actually have control over. And that can be very sobering. That can be very humbling to admit that we are wrong all along about our worst possible outcomes. It doesn't mean bad things aren't going to happen. In fact, bad things will happen. But if we're grieving before the bad thing even happens, we've just lost joy twice, right? We still want to move in direction of what really matters to us. And that's different for every person.
Yeah. Wow. Man, you're putting a lot of like technical terms and
Sure.
methods to a lot of the problems and all of that I've come across throughout my life. It's really beneficial. This has been fantastic so far. I want to switch gears a little bit. I think it's still tangentially related, but I want to talk about the online sort of like hustle culture.
Ooh.
Yeah.
Okay.
That one is interesting because you can get stuck in that. You can get stuck in the trap of the self-improvement trap is really, really sticky.
Oh, self-improvement. Are you talking about like the wellness culture?
Yeah. You can. I've noticed a lot of
okay.
people get like. I did this for a while as well, but you get sort of like obsessed with this hyper optimization.
Oh, totally.
I'm never at a place where I'm good enough. There's always a little bit more. I can always add 5 pounds to the bench press, or cut a minute off the mile. So.
Oh my goodness. Okay, where do I begin? I will summarize my feelings about this because this is a very rich topic. And there's certainly a dark side to wellness culture, or going. Everyone needs a side hustle. Everyone needs to optimize, improve, and do more. This specific culture really preys on, I would say, very high achieving folks. Women, for example, someone like myself who who is a mother, who has her own practice. A lot of people are starting to feel that wear and tear. But like my honest opinion and truth is that it's harmful when the narrative is if you're not building or scaling or monetizing, you're wasting your time. And that time is only valuable if, this is very based in capitalism, if you're making money, for example. And so if we're only measuring our worth on in how we're, being a improved person who has done the work and is making conversions and is making money, and not based on our connection or just our happiness or contentment, we're going to have a lot of burnout. There's going to be a loss of identity. There's going to be a belief that when I'm resting, I'm worthless or I'm lazy even. And so, I know I'm going kind of in different directions. The self-improvement trap, this does start with good intentions, growth and healing and purpose. Obviously, I am all for that. This is why I got my PhD in psychology. I'm here to help people continuously grow. But if this morphs into you are not enough as you are, you have to keep doing more, you're not going to feel like a person. You're going to feel like you're a project. And if you're just trying to heal all the time, you're really forgetting to live, right? In what we're doing. And so the cold plunges and all the journaling that we can do all the time, or shadow work, or even matcha, like, believe me, I'm all for that. I feel like I have truly done it all, and I will probably still love doing this. These become, what is it? Part of this idea that I'm not fully healed, or I'm not full unless I'm doing these things. And there's always more things that we can do, right? What is my actual purpose? If there is money to be made from these things and someone's pushing it, then there should be questions there. There should be skepticism over, even if it's from a podcast, like, everyone needs to be able to choose what they really value. But if there's this idea that we have to continuously optimize our lives, we're going to get burnt out. I think it's simple as that. We're not going to feel like we're just enough as we are. Another thing I wanted to share about this was that I think it's perfectionism in disguise. It really is. Sure. Optimizing our sleep. So I have an Oura Ring. I love it. I've had it for almost a year now. And as a sleep specialist or, expert, I can see how harmful it can be to really get fixated on getting 8+ amount of hours of sleep. But specifically as a mom, it's not realistic. And the kind of dopamine that I experience every time I am able to meet my goal versus the days I don't get enough sleep, tracking can be really harmful for that. And while I love, all the tools and tips to improve my health and sleep, I really try to take a step back and be aware of what the hold that it has over me. There's hyper individualism too in this. Fix yourself. Everyone needs to fix themselves. I work with a lot of single folks who are dating or entering the dating pool, or folks who are divorced, and there's a lot of pickiness and high standards with dating, which can be great. I can talk more about relationship OCD another time, but this idea of I can only be with someone who has done all this healing or done the work, it's really fascinating. I think there's a lot of hyper individualism in this idea of we all need to be healed and fixed, when the reality is we are enough as we are. And there's a lot of disconnect from community in this hyper individualistic culture, capitalist culture of always doing more and more and more. So rest. We all need to rest more. Simple as that. Rest is resistance. That's all I can say more, but I'll stop there. We need to do less.
Yeah. What does good rest look like?
It's intentional. It's not guilt-ridden. And by intentional, whether that's planned or and the reason why it needs to be intentional is if you are doing the bed rotting where you're in bed all day long, but you didn't want to, and you've been trying to get yourself out of bed for the last couple hours and you just feel horrible about yourself, that's not intentional rest. That is not great bed rotting. But if you said, hey, I've been working all week, it's Saturday, I have a movie I want to watch, I have my favorite ice cream, this is how this is what I want to do, I want to recover, and I'm going to do this for X amount of hours, that wasn't intentional. That's aligned with your values, that's aligned with what you need to decompress and recover and recharge. So I guess I have a harder time with folks who are feeling really guilty and shameful about the times where they just basically knocked out or watch a bunch of, binge watch their favorite show. I'm for that when we can plan it and it can really refuel you, because the idea of resting is to really allow ourselves to be fully in that moment. And so much of what feels like rest to a lot of people after their busy 9 to 5s is avoiding or dissociating even. Mm-hmm. And while that can happen, and that's not the worst thing ever, if we can be intentional about what we're doing, we can be more mindful in the moment, we are going to recover much faster. We are going to be more present in that rest. We're going to be more present in our relationships and when our job starts up again on Monday. And so I think the idea of being intentional about our rest is the most important part of resting. And then, of course, giving yourself permission to do so in the first place. I think I run into a lot of folks who say, but I don't even have time. And it's like, don't worry, your body, you say you don't have time, but your body will make time. You will likely get sick. If you're not giving yourself time to get rest, you're going to have the worst flu that you've ever had this next season. Believe me, your body will tell you when you need to stop. Why not get ahead of that so you can kind of plan it and you can enjoy it more?
Definitely. Yeah. Yeah. It's so important. It's so important for me to schedule my rest. If it's something I do on a whim, it's like, I'm so tired, I'm going to take 4 hours. It's like, that I don't really do anything with that 4 hours. Like, I do that thing where you scroll for 4 hours and then you're like, where'd all the time go? I thought I was going to rest.
Oh, absolutely. And believe me, that can be fun too. Like, sure. I love a good TikTok scroll. I love kind of losing time with it. But if that ends up being a pattern and it is like coupled with the avoidance of another task that's really important, then yeah, we need to take a step back. But I agree that our devices, right, they can be a time suck, and we just need to be intentional about it.
Why is this intrinsic? What's this intrinsic drive for purpose? Where does that come from?
Ooh. Because I was going to say, as when you asked, what are people looking for? My answer is purpose. But what people are really searching for, and this is okay. I'm just going to wing this. Underneath all the mundane and tasks and endless scrolling and self-help and optimizing, therapy, burnout, I think people are searching for, one, safety. And this is not, yes, physical safety, sure. This is like, we're talking about like the Maslow's hierarchy of needs. We all need physical safety, but emotional safety. Am I allowed to be who I am here in this room, in my marriage, in my workplace? We need a nervous system that can exhale. And so that kind of leads me to some belonging. A lot of us, as a core human need is not to be liked, as important as that is, but to be known, to be accepted, to be included, to feel chosen even. That is a core human need, belonging. And again, that leads me to the next one, which is people are searching for meaning and purpose, like you said. Why am I here? What is a purpose? And we can do this through many different areas, like spirituality and religion, like my upbringing. But also, if we don't have religion in our lives anymore, which also includes myself, we find that meaning in our community. Maybe that's in our work, our relationships, or just pure existence. Maybe it's just enough to just be on earth at the time that we are now. And that can be meaningful. I think other ones too, I could talk a lot about like love, right? We all have a core need for deep connection and intimacy And it's not really the romantic part, but it's more about like just being loved for who you are and all your mess. It's not a performance thing, and that gives us relief because when I see clients, when I have clients reach out to me for therapy wherever they are in the country, because I get to see clients in PsyPAC states, they're reaching out because they want relief. That's what I'll say. People want relief from pain, pressure, discomfort, perfectionism. And so we want relief from our own minds sometime. And so all that kind of goes back to safety. Like as humans, people are searching for safety, and optimizing our sleep, we think will lead to that. Joining a new self-help course, getting a new therapist. The hope is that we all find that safety. And one really empowering thing is to really find safety where we're at in every moment. And that brings us back to the breath. That brings us back to tolerating the unknown. And truly, I will say the most important kind of mental health tip that I would give to anyone in my life is if you can tolerate the unknown and uncertainty, you're the most powerful person in your life. You are saving yourself, truly. And it's something that I think most of us have a hard time with. And how could you not? But if we can tolerate it, if we can embrace it, if we can be curious, wow, then you got it good. You have freedom. You have true freedom.
Yeah. So I guess my last question to you before we close this out is, if you could whisper one thing into everybody's ears, everybody on the planet, what would it be?
I feel like it's what I just said.
Yeah.
But which is that, it's so funny because I feel like my answer before I became an OCD therapist is it's all going to be okay. And an interesting thing is it probably is. Like, even in our worst circumstances, we are so much stronger than we realize. We're so much more resilient than we realize. But the reality is some things aren't okay. There's so much destruction and suffering. We see that every time we turn on the news. There's so many awful things going on. But when you know who you are and you have the tools and you know that you're going to cope with the worst case scenarios, that's empowering. So maybe it's a variation of, you know what, it might not be okay, but you're going to find a way to be okay anyway. Things might not work out in your favor, and do it anyway. This new relationship you're joining might turn out horribly. I'd rather regret the things that I didn't do than the things that I did. Or actually, is that reversed? Oh my gosh. Okay, Devin, I'm tired.
No worries.
Okay, maybe I'll just replace all that with what I would whisper to every person is the kind of maybe not, that fear that you have, that thing that is keeping you from, your dreams, your goals, right? Really ask yourself, is it my fear that's keeping me from taking the next step in my life, or are they my values? And if it's your fear, then we gotta move in the direction of your values. So don't let your fear get in the way of your values. Yeah.
That's good. That's really good.
Thank you. I'm fumbling my words. We can't go longer. I'm just gonna mess up more.
Yeah, no worries. Where can people find you?
Yeah, so people can find me on my website. It's hollyphd.com. I have an Instagram account, holly.phd. I have blogs on my social media, my Facebook, Instagram. I have a podcast that I did last year on different various psychology topics. And I'm available for individual and couples therapy across all PsyPAC states. I think that's 42 states in America. I'm based in Seattle, Washington, but I love hearing from new folks. I spoke on a flight anxiety podcast and got to meet a lot of people who've listened to that podcast. So I love when people reach out.
Awesome. Holly, thank you for doing this.
You were so welcome. It was so nice to talk with you.